The chiropractic adjustment is one of the primary tools that I use in practice along with the majority of the chiropractic profession to make a change and effect in the body to treat function and therefore symptoms. If you want to find out what a chiropractic adjustment actually does, then check out the video above that I've done previously for more information on that. In this video, however, I'm going to go through whether we actually need to hear a pop or a crack as we make the adjustment for the adjustment to actually work. So let's begin. The joints that we usually adjust in the body have fluid inside them. We call this synovial fluid. So as we make the adjustment, what happens is that we are stretching that joint, so we get an increase in volume within that joint, which therefore decreases the pressure, which creates a small gas bubble in the joint. As the volume within the joint rapidly reduces, that bubble is very quickly popped, which is what creates that sound. This, though, is not the only thing that happens when we make an adjustment. Surrounding the joint, we have ligaments and muscles and different receptors within that joint that change and are affected as we make that movement within the joint. Those receptors send a signal to the brain, and that then actually makes a change within the brain. So essentially, if we hear the pop within the joint, what that means is we've moved it to the point that we've created that gas bubble and it's popped. If we don't hear that pop, that doesn't necessarily mean that we don't have an effect within that joint, because we can still make an adjustment to a joint without bringing it to the point that we create that gas bubble. So therefore we can still get the changes in the receptors around the joint and the ligaments and the muscle. And that is the primary effect that we're looking for. We're looking to change the position, the resting position of that joint by affecting the surrounding structures and to increase the movement within that joint, so that when, for example, if the joints within your spine, when you move the spine, then the entire spine is working in concert and you don't have that restricted joint within the spine. If you have a restricted joint, what happens is that the other segments within the spine are going to have to compensate and therefore move more, which can cause an irritation and problem within the spine. So essentially, we don't need to have a click or a pop within the joint. It all depends on what kind of effect we're looking to create. If we get that pop, then we know for sure we've moved it a significant amount, but sometimes we don't actually want to move it that much, particularly if somebody's very acute or very sensitive in that area. We might want to start a little bit more gently. So I hope you found some value from this video. Please do pop any questions in the comments that you have for me, and I'll see you on the next video.